According to science, a brain tumor is an abnormal growth or mass of cells in or around your brain. Now, not all brain tumors are fast-growing, and a brain tumor does not necessarily start in the brain. Brain tumors can also happen near the brain tissue. So, brain tumors range in size from very small to very large. Some brain tumors are found when they are very small because they cause symptoms that you notice right away. Other brain tumors grow very large before they are found. Some parts of the brain are less active. It may not cause symptoms right away. The brain tumor size could become quite large before the tumor is detected. Now, let's explore top 10 brain tumor symptoms which may vary from person to person. Number 1. Headaches, which are often the first symptom. A headache due to a brain tumor usually becomes more frequent as time passes. It may not get better with over-the-counter pain medicine, and it may come with nausea or vomiting. It can get worse when you lie down, bend over or bear down, such as when you have a bowel movement. So see your doctor if you have a headache with eye problems such as seeing flashing lights or blind spots, or that got easily steadily once over a period of weeks or months. Number 2. Seizures. Seizures happen in up to 80 out of every 100 people with a brain tumor. You might have some jerking or twitching of your hands, arms or legs, tingling and difficulty speaking, strange smells or sensations, staring and unresponsive episodes or convulsions. Or your seizure might affect your whole body. Having a seizure is very frightening. Different illness can cause seizures, and it is important that you see your doctor immediately. Number 3. Changes in mental function, mood or personality. You may become withdrawn, moody or inefficient at work. You may feel drowsy, confused and unable to think. Depression and anxiety, especially if either develops suddenly, may be early symptoms of brain tumor. You may become uninhibited or behave in ways you have never before. So when you see such signs, it's good you visit a medical professional for early diagnosis and treatment. Number 4. Feeling or being sick. You might feel or be sick, especially when you move suddenly. It's rare for people with a brain tumor to have sickness on its own. You may have sickness with headaches, weakness and problems with your eyes. So don't ignore this kind of sign. Seek for early diagnosis and treatment. Number 5. Drowsiness or loss of consciousness. You might feel drowsy or even lose consciousness. This might happen because raised intracranial pressure can lower the blood supply to the brain. This can be frightening for you and the people around you. A brain tumor may cause a big, obvious seizure. During this type of seizure, you lose consciousness and your muscles jerk uncontrollably. A brain tumor can also cause a small, less noticeable seizure. Number 6. Problems with your eyes. You might find that your eyesight is getting worse and glasses are not helping, or your vision comes and goes. You might also lose the ability to see out of the corner of your eyes, making you bump into cars or objects on your left or right sides. You may also have a blurred vision, floating shapes, tunnel vision. So when you see these signs, kindly visit a healthcare center for early diagnosis and treatment. Number 7. Personality and behavior changes. You or the people around you, they might notice that you are confused or that your personality has really changed. You may also find it difficult to think normally. This can have a huge effect on someone's mood and behavior. Similarly, coping with many of the side effects of a brain tumor or its treatment can drastically alter someone's mood. When you see such signs, it is good you visit your doctor for diagnosis. Number 8. Changes in speech. This happens when one finds difficulty in expressing him or herself or getting a trouble in finding words, and also to understand language. Examples of speech challenges that some patients with a brain tumors may face are dysphagia and apraxia of speech. Dysphagia can cause slurred speech due to muscle weakness and making it hard to pronounce words. Number 9. Loss of balance or coordination. When a brain tumor is located in the cerebellum at the back of the head, may cause trouble with movement, walking, balance, and coordination. If the tumor affects the optic pathway, which is responsible for sight, vision changes may also occur. Also, a brain tumor creates pressure on and changes the function of surrounding brain tissue, which causes signs such as headaches, nausea, and balance problems. Number 10. Changes in pulse and breathing rates. So if your loved one is anxious or agitated, or if their tumor is in the brainstem, they may breathe faster and become breathless, and their breathing can change from one type to another in only a few moments. Sometimes in the last few hours, there can be a sort of rattle to their breathing. This can be a bit alarming and some people find it upsetting. These symptoms do not always mean you have a brain tumor. However, it is important to discuss any symptoms with your doctor since they may signal other health problems. So, many other types of rare tumors can happen in and around the brain. Tumors can start in the muscles, blood vessels, and connective tissue around the brain. Tumors can be formed in the bones of the skull. Malignant brain tumors can start from the germ-fighting immune system cells in the brain. However, you need to see your doctor if you have any of these symptoms or other changes that are unusual for you or that won't go away. Your symptoms are unlikely to be cancer, but it is important to get them checked by a doctor.